Today, we will talk about how to stop root canal pain. Let's have a look at the details. It's easy to think of teeth as simply being bones, but they're more than that. Your teeth are made of multi-layered hardened tissue and are buried in your gums. Enamel and dentin are made up of minerals that protect the inside of your teeth. This inner part of the teeth contains sensitive nerves and blood supply. Unfortunately, bacteria can damage protective coverings. Demineralization can lead to infection, inflammation, and cavities. Your dentist may recommend a root canal to clean the area and relieve the pain. The first step is treating pain at home. Take pain medication. Your dentist may prescribe a pain reliever for you to take after the root canal. If not, or if the pain is only minimal, take an over-the-counter pain reliever like ibuprofen or acetaminophen according to the manufacturer's instructions. Use ice to relieve pain. Ice can temporarily numb the pain from your tooth. Use a saltwater solution. Relieve toothache by dissolving 1/2 teaspoon of sea salt in 4 ounces, 118 milliliters, of warm water. You can do this up to 3 or 4 times a day, just don't swallow the saltwater. Bite down on a fruit or vegetable. Chill a slice of fresh ginger, cucumber, or raw potato and place it over your painful tooth. Or, you can freeze slices of banana, apple, mango, guava, or pineapple and place the slices on your aching tooth. Cool fruit or vegetables can numb the pain. Make a tea compress. Take an herbal tea sachet or dip a clean cotton cloth in warm herbal tea. Set the cloth or sachet over your painful tooth and leave it there for 5 minutes. Apply an asafoetida paste. Take 1/4 teaspoon of asafoetida powder and mix it with enough fresh lemon juice to make a paste. Apply this directly onto the tooth. Repeat this 2 to 3 times a day. Use a heat pack. Some people find that moist heat can help relieve the pain the day after your root canal. Know when to contact your dentist. If you've tried several of these treatments, but feel severe pain, call your dentist. You should also get in touch with your dentist if you notice pressure that lasts several days following your root canal. The second step is practicing good dental hygiene. Brush your teeth correctly. Brush your teeth and gums at least twice a day. Don't forget to brush your tongue too. Floss every day. Gently guide the floss between all of your teeth using a gentle back and forth motion, curving the floss around the bottom of each tooth. Massage your gums or erupting teeth. Use a clean finger and gently rub the gums or the top of the tooth that's breaking through the gums. You can also massage your gums with an anti-inflammatory and antimicrobial oil that can reduce swelling and relieve pain. See your dentist. You should visit your dentist and have your teeth professionally cleaned at least once a year. Get more frequent cleanings if you smoke, have heart disease, or have diabetes since these are linked to dental health. Replace your toothbrush. If your toothbrush bristles are fraying, it's time to replace the brush before it starts damaging your teeth. Dentists recommend replacing your toothbrush at least once every 3 or 4 months. And, the third step is understanding a root canal. Recognize the risk factors. Sometimes the nerve in your tooth might just die. Or, you have a cracked or chipped tooth that leads to tooth decay in the tissue within your tooth. These may be caused by an injury to the tooth. When your tooth is injured, inflamed, or suffers nerve death, your tooth will struggle to heal itself. Consider your symptoms. If you're experiencing pain, sensitivity to either hot or cold, sometimes both, tenderness, swelling, or discoloration of the tooth, talk with your dentist. These may be caused by inflamed tissue or infection within your tooth. They may also be caused by a neighboring tooth and not the tooth you suspect is causing the issue. Don't wait more than a week to talk to your dentist. Know what to expect during a root canal. A dental specialist, endodontist, will clean out the inflamed or infected part of your tooth's root. A filling made of a rubbery material, gutta percha, or a crown restores your tooth. You'll be given a local anesthetic during the root canal, so the procedure shouldn't be painful. Thanks for watching this video. Please don't forget to like and subscribe to our channel if you like our videos.